This is my audience. My note cards. What's the first thing that you notice when you meet someone new? When you meet someone new, you're usually face to face, so what I notice first is their smile. Because of this, good oral hygiene is very important because you want to leave a good first impression and not a bad one, and be known as the one with bad breath or the one with rotten back teeth. According to the National Institute of Dental and Craniofacial Research, dental caries remains the most common chronic disease in adults, even though it's largely preventable. In order to have good oral hygiene, you want to brush and floss properly, have a low sugar diet, and you want to visit your dentist regularly. So now let's begin with properly brushing and flossing your teeth. You're going to need a soft bristle toothbrush, some fluoride toothpaste, and some floss. You want to brush your teeth for about 2 minutes, twice a day, one in the morning and one at night. At night is the most important one because then when you go to bed, all your food sits in your mouth, and that's when cavities are more prone to happen. So now I'm going to show you the proper way to brush and floss your teeth. You want to place the toothbrush at a 45-degree angle at the gum line, and then you want to use circular motions by your gums, like if you're massaging them, and then go up if you're doing the bottom one. So you want to do 2 teeth at a time, and then go up and up again, and then you move on to the next 2 sets of teeth and massage and go up, and so on. For the occlusal teeth, you can just brush up and down. Make sure to get all the surfaces. And then for the front teeth, do the same thing, but this time place your toothbrush at a vertical angle, and also massage the gums, and then go up and down. Massage and then up and down strokes. And then also for your inside of the mouth, you do the same thing. Place at a 45-degree angle, massage in circular motion, and then massage in circular motion, and then go up. Also, you don't want to forget to brush your tongue because your tongue is full of bacteria, and that can also cause bad breath. So you can just brush your tongue out like that. And then that way, when you brush your tongue, it's going to keep your breath nice and fresh. You want to change your toothbrush every 3 to 4 months, or sooner if it starts to wear out. Now for floss, you want to use about 18 inches of floss, and then just wrap the floss around your middle or index finger, doesn't matter, whichever you feel comfortable with. And then wrap it around your finger, and then the other end you can just wrap it twice. And then to floss, place it in between the teeth, and then brush in a C motion, like that. And then the other side. and then next to the teeth, and then until you go all around your whole mouth. Another thing you don't want to do is after you brush your teeth, don't rinse your mouth out, because that's what people usually do. And then when you rinse your mouth out, you're spitting out the fluoride that helps maintain a strong, healthy teeth, and also helps with preventing decay. Another way to have good oral hygiene is by having a low sugar diet. You should be smart, snack smart, meaning that you shouldn't consume too many sugary snacks in between meals. If you do, just make sure to brush your teeth soon after you do. Too much sugar in your diet can cause cavities, and then if you don't get your cavities treated, then they can be very painful in the long run. Other than having good oral hygiene, you also want to visit your dentist regularly. You should visit your dentist every 6 months for checkups and cleanings. You can also ask your doctor any tips he may have for you for you to have good oral hygiene. My dentist told me last time I went for my visit that if I couldn't brush after every meal, then he suggested that I chew sugar-free gum like Orbit and Trident, and that the gum has an ingredient that can help with preventing cavities. Now let's go over what we have learned. We have learned to have good oral hygiene by brushing and flossing regularly, having a low sugar diet, and by visiting your dentist regularly. I hope that from now on you will practice good oral hygiene so you can leave a first great impression even when you get to be 90 years old.